Welcome to UNCAGED, a show that celebrates thought leadership from today's top business leaders. The program provides a voice to amazing executives from around the globe who are shaping the world of business today and mapping the path to the commerce of tomorrow. Today, we're speaking with Veronica Villarreal. Veronica, how are you?
Great.
I'm excited to talk to you, Veronica. Veronica is the Chief Ambulatory Officer at DHR Health. We'll be talking a lot about healthcare management, quality patient care, and really kind of the transformation of healthcare services in general. But before we get there, Veronica, tell me a little bit about you and your career.
So a little bit about me. I'm kind of homegrown at DHR Health. I went to school, came back as an intern, went back to school, and kind of just made my way up pretty fast. But I sometimes say, like, just put in the work. I kind of sacrificed everything else and focused on my career, but I love it. I started in the revenue cycle, the projects of different things. I feel like that's such an important piece to start and understand operations because everything, even clinical, hits revenue cycle. So from start to finish, and that's really helped me grow into the health system in the clinic area. So ambulatory, sometimes people think, oh, you oversee the surgery centers. No, I oversee the ambulatory care clinic arena. So that's kind of my expertise, I feel now. We oversee about 75 clinics, and it's all multi-specialty driven, not really focused on primary care, which that's our goal this year, is to employ primary care physicians. As we know that there's a lot of different things that go on with referring to our specialists. We have a lot of ACOs or Medicare and Medicaid trying to put programs in place. So we keep costs down, but that doesn't necessarily always work for the best patient quality care from my standpoint, because I see it from the multi-specialty standpoint. That's really how I get my data from.
Well, I mean, I love stories like yours, Veronica, where people basically have worked at an organization and really have done almost every level of role. And so you understand how things actually work, not what they're how they're theoretically supposed to work. But let's take a step back. Tell me broadly about DHR Health and what it is, and then let's dig deeper on the ambulatory area after that.
DHR Health, and obviously I bleed teal. That's our color, just because, like I said, my story, I'm homegrown here. It is actually a for-profit, so it's physician owned, and it's one of the largest actually in the nation. We're in the tip of Texas. So everyone says San Antonio. I'm like, no, 3 hours down from San Antonio. So if you say Reynosa or Tamaulipas, 20 minutes from Reynosa.
Oh, perfect.
And so the decision makers are here. The board is here. It's not corporate. So it's a little bit different. I was under the mentorship of, when I was an intern, of an ex-CEO, and she started working with us. So she would kind of tell me the difference. Well, mijita, and in our culture, it's very, down here, it's predominantly Hispanic. So those terms are okay in the workforce. So now we see it as, okay, we need to be careful of not calling a patient mommy, or, because some people don't like that. But she would tell me, this is how corporate does it. This is how we do it. So I think it's pretty fun. We're actually, they started as a surgery center. Now we're a 530 plus bed facility. We have a level 4 maternal designation for our women's hospital. We are now expanding in Bronzeville, which is an hour from us. We also serve a rural county, which is Stark County. for specialty care. So we work really closely with the hospital, the rural hospital there. So sometimes I think we say we keep everyone grounded in healthcare down here because we do things not necessarily thinking of just cost. Sometimes in healthcare, you're going to do things that don't necessarily make financial sense, but they make
Mhm.
community sense. So I
Yeah.
think that is why I stay, the purpose that I have set for myself, always helping others.
Yeah.
So,
And I mean, I think that the interesting challenge these days in the healthcare space is there's so many new technologies, new innovation, which is exciting for sure. But I mean, patient care has been a challenge because just one of some of the restrictions that we've been living through with the pandemic, but certainly just the volume of need and how to process all of that stuff. Tell me a little bit about what you're seeing today, Veronica, as some of the big challenges that you guys are facing.
so pre-pandemic, I think I got into this role 2019, and I was like, 2020 is going to be our year. I Every year that comes, 2021, 2022, even this year, I will never say that again. So I always say now, this year is going to be what we make of it.
All right.
um, so we were rocking and rolling 2019. DHR Health really started growing the ambulatory space. We were fairly new, probably like about 11 years. And we expanded. Now I have over 200 physicians and in different areas. Our biggest service line is cardiology.
Right.
But when the pandemic hit, we proudly, I can say, we didn't close our doors. We were able to figure it out, not because we had staff, but because we are one team.
Hmm.
I am blessed to say that I have a very passionate team that we all have the same vision, which is patient care, people always. So we were able to help each other. There was some days that we had one MA for 6 physicians. So we just had to figure out what was the bare minimum that we had to do to provide patient care.
And I mean, I love that phrase, patient care, people always. I don't know if that is a official motto of DHR Health, but
No,
it's
it's just mine.
I think Veronica, maybe you need to lobby for that one. It's been an interesting one. Are there specific challenges that are perhaps more focused on these days? Is it that people really coming in for specific types of services these days, or has there been an upsurge, or how has the pandemic really kind of shifted that? I guess that's really what I'm kind of get at.
Yeah, so from the specialists that I talked to, a lot of some of the primary cares that would refer to us, or people really not even wanting to seek care because they were scared to even step foot in a physician office. During COVID, even 2021, we started seeing more high acuity patients where if they were treated or seen in 2020 or in
Mm,
2021, they would not be as sick as they are now.
mm,
So that's kind of been hitting our specialists a little harder. Just like, they are caring by trade. That's really why they went into medicine. And that's one of the sad things that they see is, I wish this patient could have come a year ago or 6 months ago. So the high acuity, that's kind of from a clinical perspective of what I've heard from them. And then
yeah.
from an operational perspective, we really haven't had this abundance of candidates in our, pool to pick from. So that's been kind of a challenging for the team is we used to be a lot more, I don't want to say picky, but spoiled to be able to be picky, I guess.
Mm.
And now we're like, okay, you have some type of customer service, we can train you.
Well, it's certainly an interesting moment on the talent front, and I think we certainly can get back to that in a second. The acuity issue is fascinating to me, and one of the ways I'm hoping that will get relieved as something that because people always wait too long sometimes to go see a doctor, is kind of some of these technological things that we've seen move forward. Are you guys moving forward on any of those types of elements, like telehealth or any of those areas?
So we had to implement telehealth during COVID. So that was the majority of what we saw. And we kind of went to, okay, we have to see new patients in the clinic. Yes, we integrated telehealth, still implemented it, where, okay, if they, your next visit, you can see them in 3 months on telehealth. But we really do want to still have that patient contact with them. So telehealth
Hmm.
is and will probably stay for us. It
Hmm.
makes sense, especially we have a lot of proceduralists, so surgeons with
Hmm.
post-op care. If you can see like a post-op from a telehealth because the cut is here or something to that sort, that's really helped our physicians kind of be able to provide that care. The patient doesn't have to come over here. It's a non-billable visit because it's already grouped, right? And we can now see more patients by telehealth. So
Yeah.
that's how it's kind of helped us as well.
Yeah, I can see that. And it certainly makes a ton of sense to continue it, especially as kind of part of a procedure, part of a cycle, right? That you would have maybe some form of surgery and kind of following on makes a ton of sense, and helps you manage time to deal with that other challenge that you were talking about, which is just talent. I've spoken to some of the nation's largest nursing groups over the last couple of months, and they've highlighted the challenges that they're seeing in that space in general. And it sounds like you guys have experienced the same thing. What's the future and what's the fix there? Is it really kind of what you were just highlighting, which is you find people and you just have to invest in education, or what?
I have always believed in that. I think whether you're trained or experienced, we should always give you formal training for you to understand our processes. So training is a big deal for me. I think if we don't give the people the resources to do their job, they will leave. I mean,
Yeah.
who wants to fail? I mean, I don't think anybody. But I think for us, we've never really done a hybrid model where we have virtual workforce, and we actually tried that. We really got it going August of last year. So one of our physicians was, I get the best ideas from everyone from the team. And that's
Right.
what I say, listen to people because they know different, they see it from a different point of view.
Yeah,
So
I was thinking about that with your experience and how you have moved forward in your own career. You understand that. I think a lot of people that sometimes come into organizations at a senior level don't really understand. Like, you kind of need to know what's going on the floor, right? Sometimes those are the people that really know what's going on.
and that helps with compassion and empathy because I know I'm a big positive thinker. I think we all have it, but if we don't understand, how can we be empathetic about it?
Yeah.
So, yes, I agree. I think it's helped me understand limitations. Sometimes um, there's people that put, oh, well, this person can do 100 things in one day. No, actually, do you understand what those 100 things are?
Completely makes sense. And it sounds to me sometimes that education, you can really find people that might be spectacular that perhaps might not have been considered in the first place because they don't have the specific keyword-based qualifications, so to speak, right? And that's always interesting. So tell me, Veronica, you said you bleed teal, I think. So what brings you so much joy about DHR Health, and what do you love about the team?
I think from the beginning, when I started, just people that are passionate about the vision of the hospital and always putting the community first. So when I was fortunate enough to oversee a team of 1,000 employees and having my direct reports, I just love the creativity. I call myself a collector of personalities.
Mm-hmm.
I love different personalities. Does that take work in getting them to love or tolerate each other? Yes. But it just gives more creativeness. And when we come up with a process, then I ask three different people, what do they think? And it's always gets better. So that's really what I enjoy. And when people start getting excited about what they do, I think that's a big piece that I like to explain to them is I don't think you understand how important your role is.
Mm-hmm.
And when it hits, oh yeah, like I didn't know that report I was sending to everyone made such a difference. So I
Yeah.
think that's what I love is seeing also growth from within. And I'm thinking, I guess, because I've been given the opportunity, I like to see like diamonds in the rough or people that are wanting to strive for more and they stay with us, but just move up.
Yeah, I love that. Listening to you, you just mentioned so many wonderful things. This idea of this phrase that you use, the collector of personalities, is just wonderful. It is also reminds me of that importance of seeing people and hearing them, and that empathy that you highlighted before. It's important that leaders do that to understand kind of the dimensions of an organization in a way that they might not understand right off the top. So it's such a great and critical point for an effective leader like yourself. But Veronica, tell me a little bit about 2023. Here we are in a brave new year. Tell me before you make a big pronunciation of saying this is the year. Tell me what you're seeing on the landscape.
So obviously we know staffing shortages is still a thing. So 2023 for our own sake and sanity and be able to not stress about having to hire, train, still having to do that, but from a virtual setting. So it's really, I think that's our biggest push. So anything that is not patient centered. So me being a medical assistant, talking to a patient all day, obviously I need that at our clinics. But me verifying insurance for a patient that's coming in 2 days before, I don't need to be at the clinic and I can have someone else be doing that for us.
Right.
So it's actually worked for our hard to fill positions. I think people were just burned out, and I
Yeah.
think people are still burned out. And being short staffed and then having to place more on someone's plate that already feels like they can't anymore is not a good thing. So we are now, that's going to be our biggest push is
Yeah.
having a hybrid workforce and selling the idea to our managers that this is going to help you, this is going to help your patients, but most of all, this is going to help your team.
Yeah,
And
I love that. It's also just, it offers a little bit more, not only work flexibility, but organizational flexibility as well. So if you can figure out how to manage that, it can be a very, very powerful tool for your organization as you scale. Clearly, DHR Health is growing, so it's a really good point. Veronica, I mean, for all those folks out there that might be interested in what you're building this year, and certainly for the services in general, where's the best place to reach you?
LinkedIn, I think that's that's kind of been my focus. Let me share my information there. If people want to reach out, I'm very active on it. So, and I'm more than willing to share my wealth and would love to hear someone else's knowledge and experience of what they're doing.
Amazing. Well, Veronica, it's been great talking with you. We've been speaking with Veronica Villarreal. She is the Chief Ambulatory Officer at DHR Health. That oversees 73 clinic locations with over 30 specialties and subspecialty care areas in the Rio Grande Valley at the bottom tip of Texas, as she pointed out. And Veronica looks after over 1,000 employees. We've been talking a lot about not only healthcare today and what's happening in the healthcare space, but really kind of managing a team effectively in the healthcare space at this time, and what you need to do in terms of maybe shifting from that mindset of, oh, we can go hire everybody, to how do we build a team? How do we educate them? How do we manage careers? How do we help people grow over time? And it's been great hearing Veronica's perspective on this. Veronica, thank you so much for being on the UNCAGED show today, and we look forward to having you back.
Thank you for having me.
Cheers.